Hi, I'm Dr. Lela Lewis, and I'm the president of Liberty and Health Alliance. It is a pleasure to have you back with us again this evening. As a board-certified obstetrician and gynecologist, and I've been watching this COVID pandemic for over a year and a half, like almost all of us, I'm sure. The last week has been a challenging one with many changes. Just this week, we've experienced national mandates and other changes, and hence the title of today's presentation, National Employer COVID-19 Mandates and Early Treatment Suppression. What next? Well, with that, before we get started, we want to ask God's presence on our discussion today, and I'm very excited to welcome Pastor James Rafferty. Pastor James Rafferty, thank you so much for joining us. He's a pastor, evangelist, speaker, director, and a good friend for some time. Pastor Rafferty, can you open us with prayer, please?
Absolutely. Good to be here with you, Lela, and the rest of us. Father in heaven, we just want to pause in your presence. We want to ask for your spirit to guide us. We live in momentous times, and difficult decisions face us individually and corporately as a world, at leadership, in the medical field. And we just ask that you'll be with this panel right now as we talk about some of the issues that we're facing in this COVID crisis. Guide and direct our conversation, for we ask it in Jesus' name. Amen.
Thank you so much for joining us. Again, it is a pleasure to have you back with us. Well, this week, COVID vaccine boosters will be rolling out. At the same time, the President of the United States of America has mandated a national vaccine mandate for any employer who has more than 100 employees. Meanwhile, we see an increasing number of young people with myocarditis and other side effects. How do we make sense of this? What does this mean? Well, to help us answer these questions and many more, I'm very excited to welcome again Dr. Peter McCullough. Dr. McCullough is world-famous academic internist and cardiologist in Dallas, Texas, world-renowned. I dare say he is the world expert on COVID-19. He's written and published in peer-reviewed articles, more than 60 different articles. Dr. McCullough is founder of multiple medical associations and a wonderful, wonderful Christian man. Again, thank you for joining us, Dr. McCullough. We look forward to you helping to clarify some of these things for us tonight. And Dr. McCullough, we can't hear you. We're having a little technical difficulties. We'll figure this out in just 1 second. Well, as we stated, we have been told that the boosters are rolling out this week. The boosters, the population that has had 1 or 2 of the mRNA vaccines will now be offered a third vaccine. The question is it every 8 months, which was originally stated, or 6 months, or 3 months? How can we answer these questions? Again, let's come back to Dr. McCullough so that he can help us look at some of these answers.
Can you hear me now?
We can hear you. Thank you so much, Dr. McCullough.
Okay, sorry about the technical difficulties.
No problem.
It's great to be on the show. And just as a brief update, we've seen a next wave of mandates now going to employers with over 100 employees, but without any real guidance to Americans in terms of what vaccines should be suggested. And we're now 9 months into the program. There's still been no report card to Americans on which vaccines are doing the best in terms of protection, which vaccines are not. There's 3 products on the market. It's extremely unlikely that they're equal at this point in time. There's probably a winner, there's probably a loser, there's probably one in between. And then I think the other big question Americans want to know, certainly the patients in my practice want to know, is how can the vaccines be given safely? And how can we anticipate patients who are going to have problems with the vaccines? None of those issues were laid out for Americans with the mandate. It's simply a mandate with no guidance.
Well, thank you so much. And the boosters, now, of course, the boosters are coming out this coming week. Any thoughts about those?
The boosters, to my knowledge, are simply more injections of either Pfizer 30 micrograms of messenger RNA or Moderna 100 micrograms of messenger RNA, but without any coverage change with respect to the Delta variant. We know by the end of August, we're now at 99.1% Delta in the United States. So this would be analogous to a flu shot, but it's not adjusted for the next flu in the season. So boosting a vaccine that is having a progressive loss of coverage as the virus mutates is unlikely to be successful.
And speaking of variants and mutations, I do have a follow-up question for that. The Mu variant we're now hearing about and other additional variants. What's going on here? There's a lot of proposed ideas as far as these variants that are increasing in frequency.
Well, the variants have always been there in the background. We've always had the full Greek alphabet in the background. In the pre-vaccination era, we had about 12 to 14 strains. And when we moved into the vaccine era, we put a selective, what's called non-lethal pressure on the virus. And so the strain that was most likely to be successful in the vaccinated environment, which was Delta, that moved forward to become hyperdominant. So unless the vaccines change in terms of their coverage of strains, Delta is going to be here to stay, right? So Delta is doing very well against Pfizer, very well against the other vaccines. There's no reason to have Mu or Lambda or Eta move forward. Lambda came out of Peru. It looks like in response to using the Coronavac or Sinovac vaccine, a paper by Arcevedo has shown that. Separately, a paper, I believe the first author is Johnson out of California, showed that Eta is coming out of California. And now we have Mu. But I don't anticipate any one of these strains to make any headway compared to Delta, since Delta really is enjoying survival and transmission among those who are vaccinated.
Thank you so much, Dr. McCullough. Well, with that, we want to bring in our not guest, our Vice President of Legal Affairs, Mr. Jonathan Zirkle. Mr. Zirkle, the Delta variant, as Dr. McCullough just pointed out, some of these new emerging variants seem to be the claim as to why we must have stronger mandates. In fact, the president mentioned something to that effect yesterday. These national mandates for employees, particularly since September 10. Mr. Zirkle, are you with us? And we want to ask you a question regarding this. Mr. Jonathan Zirkle. Well, we'll come back to Mr. Zirkle in just a minute. Let's go to Dr. Dana. Dr. Dana is a clinical psychologist, and she focuses on helping children, in particular, children with trauma. Dr. Dana is the CEO of Mind Care. Childhood trauma therapy is her expertise. And we have some questions as far as fear is concerned. Fear in society. These national vaccine mandates have definitely been, I dare say, a result of societal fear. How do you view what's going on as a clinical psychologist?
So what I've been doing, actually, I'm a school psychologist, but an educational psychologist, but to look at the trend is so important for us right now. And you can, I don't know if you can see the PowerPoint right now, but before COVID took place, there've always been data on what's going on in terms of mental health. So the CDC have information, but look at what happened right after COVID took place. In 2019, the CDC was looking at, what's going on in terms of depression and anxiety and various other mental health situations in America. There's a huge jump from January 2019 was 11% of America that had anxiety and depression. In December of 2020, the CDC took information from the US Census Bureau and look at this jump. It is absolutely unheard of. To 42% of Americans are struggling currently with anxiety and depression. Just to kind of give you some more statistics, because it's good to look at the trend to see what's going on. The Kaiser Family Foundation is also keeping track of the data as well in terms of mental health. And they're seeing a skyrocket increase, especially during the summer, of almost half of Americans are currently afraid of have some kind of fear that's impacting their mental health. So this is worry, stress related, that they're saying that these things are impacting them greatly. And just to kind of give you some more data to kind of see who indeed are impacted, look at the ages, look at the individuals. They're seeing that three population in general there's a huge increase of 61% of individuals between the age of 18 to 29 are experiencing some mental health situations right now, worries and anxieties and so forth. The second group is mothers, so individuals with children. And then the third highest group is also women. So that, again, is very puzzling and also concerning for us. But if you notice, all of the group and categories that they've broken them into, none of them are down to that 11%, while that was before the COVID took place. And just, it's good to see the trend so we can kind of understand what is going on. It is stated that 9 out of every 10 women under the age of 30 is experiencing some kind of negative mental health impact. So we're seeing a suicide rate, we're seeing increase, we're seeing depression increase, we're seeing anxiety increase. But even along the male population, that age of 18 to 29 is very concerning. So it's interesting that you started out by sharing how that group is actually experiencing some physical health concerns at this point. And throughout, they stopped actually researching and looking at this data, but overall individuals' mindset about what's going on, what's going to take place, have always been on a negative mindset. Everyone is seeing that, or saying or believing that the worst is yet to come. So you see those numbers are really high and very concerning as well. So that's what's going on in terms of mental health. But we're seeing that there's such an increase, especially along the age of the 18 to 29, the women, and it's very alarming. And that, by the way, is the number, our numbers are increases in terms of referrals that I'm getting in the clinic here that we have in Somerville, that number is really high in terms of our referrals as well. So it's something that we need to really consider.
Wow. Thank you, Dr. Dana. That fear has definitely affected, and we'll come back to you in just a minute, has definitely affected our society. And I dare say, as we were mentioning just a couple minutes ago, played a role, I believe, in some of these mandates that we're seeing. With that, I want to come back to Mr. Zirkle. Mr. Zirkle is both a legal counselor. Thank you so much for joining us, Mr. Zirkle. And he's also head of legal affairs, our vice president for legal affairs for Liberty and Health Alliance. Thank you, Mr. Zirkle, for joining us. We have a question for you, and many are asking this question. Is it legal for the federal government to mandate that individual states enforce a national vaccine mandate, particularly, again, coming from what Dr. Dana talked about, this fear position? Mr. Zirkle.
Yeah, well, that's an interesting question. We're having some of the governors that are vowing to challenge that. And honestly, this is a new area, and we will find out when the courts tell us. One of the things I'd like to point out is that the way these mandates work is that they're actually really trying to put the burden on the employer to do the enforcement. And so it'll just be interesting to see what happens. None of us know. We're in uncharted territory right now.
Thank you so much, Mr. Zirkle. Well, as a follow-up to that question, coming back again to the same question about the national vaccine mandate, is there hope that people can turn to the legal system, that employers and employees who might not feel that this is something that they religiously agree with, is there still a place for that in our situation? And how does that relate to even what's taking place in Maine and New York already?
Yeah, well, there's definitely hope. None of these mandates change the Constitution, and there's a long tradition of providing religious exemptions to vaccines. So there's still plenty of hope. The same exemptions happen. The big change now is that these mandates affect a lot more people, which means there's going to be a lot more people asking for exemptions. And that honestly means that if your employer doesn't give it to you, there's going to be a real big swamping of the courts. Now, you mentioned something that's very interesting, and that's Maine and New York. Both Maine and New York have come along and said, you know what, we're going to explicitly state that there is no religious exemption. And so I'm getting a lot of people that are all panicked about that. There's a big lawsuit right now in Maine where this is going to be challenged. Basically, what Maine is trying to say is that their law trumps the U.S. Constitution. And that's just not the way America works. The way America works is federal law, and the federal Constitution trumps the state constitutions. And so this is going to get in the courts. The really sad thing about all of this is that we have a system that's more efficient for handling these kinds of exemptions. But because these states have said, no, we are not going to allow them, it's going to take regular lawsuits. It's not going to use the normal system for dealing with these kinds of complaints. And so hopefully the case in Maine will sort it out quickly, and we can figure out what's going on and things can become more efficient. But the way I see it with all of these new mandates, there's going to be so many people asking for exemptions that the court system is going to be completely swamped.
Thank you so much, Mr. Zirkle. You know, we want to come back to this fear aspect because it really is a huge, huge problem. Just as Mr. Zirkle is talking about, our own Liberty and Health Alliance is receiving many, many emails and calls, particularly from people who are concerned. Well, Dr. Dana, we have a follow-up question for you and your explanation of how we got to this beautiful place in society. We want to ask you, what are the effects of living in fear? What happens when someone lives chronically in fear?
Right. So one of the areas that I focus on mainly is trauma. So I see a lot of research, and I do a lot of research on trauma. And looking at just trauma in itself, individuals living in fear, there are areas of them that impacts them greatly, all areas in their lives pretty much. But their physical health increase, greatly in terms of weakening their immune system. And I don't have to go into the details of that and the importance of our immune system. But we also know that about cardiovascular damage being reported and research. We're also hearing various gastrointestinal. And so, you guys can discuss all of these details in terms of physical health. But in terms of our memory, they're showing that fear can impair the formation of our long-term memories. So there's damaging that's being shown in our amygdala, which is the area that does with the memory part of ourselves, that regulate the fear aspect of things. And it leaves a person feeling very anxious if you can't remember things. So individuals, especially dealing with chronic fear, they're showing that, living with that fear, they have a hard time making decisions, obviously. And another area is processing. Their brain processing, there's a lot of processing defects, their inability to process, or cognitive processing and cognitive efficiency is impaired. So they're not able to regulate their emotion as they should, or read verbal non-cues, to be able to read other people, to be able to act the way that they normally would act. So there's also ethical impact to their ability to process information. So making decisions, thinking, their ways of turning their negative thoughts to positive ones are impacted as well. So can you imagine, as they said, that, fear does drive people to make decisions, but if you're not able to do them with a right mindset, then there you have the mental health problems, which are increasing in fatigue, also depression, and even the damage in relationship as well. So there's a lot of impact that's happening when people are living in fear.
Wow. Thank you, Dr. Dana. And that leads me to another thought. You know, a number of us, some of us, I myself am a Seventh-day Adventist Christian. And I know many, regardless of our specific denomination, believe in holistic health. Physical, mental, emotional, and spiritual healing. It just so happens that the Seventh-day Adventist Church has been teaching this for about 160 years. But this is something that God taught us back in the Bible. Let's just go back to Genesis, and we can see this direct relationship of the physical aspect of health, which we've already seen causing mental effects and mental health issues. But we're also seeing, as Dr. Dana just pointed out, that the mental directly affects the physical. But we want to come to the spiritual question because we believe that this is a whole aspect of health. And with that, again, I'm very excited to welcome Pastor James Rafferty. From a spiritual perspective, Pastor Rafferty, what is this fear factor that society is now living with? And what are the moral implications? You know, I've heard many people, and I say this very practically, I say this in no condemnation whatsoever. It's a practical aspect of our life. Many people are so fearful that they're going to lose their job. This will have a huge impact on their children, on their family, on their livelihood. That the end, you know, it just keeps going. So what are the moral implications? And if there are any, if one chooses to do something out of fear that they may not think is the best thing morally that they should do. Pastor Rafferty, help us unpack that kind of big question.
Okay, well, there are a couple of Bible verses that we want to consider. The first one that I think is the most significant is in 1 John chapter 4 and verse 18. And it basically says that there is no fear in love. Now, a few verses before that in 1 John 4:8, it says God is love. So there's no fear in love. There's no fear in God. God has no fear in him. And then it goes on to say, but perfect love casts out fear. So fear is actually something that is the opposite of love and is cast out by love. And the reason why God casts out fear is because fear has torment. And those that fear are not made perfect in love. So there's this big controversy now about, you know, to be vaxxed or not vaxxed and COVID and this idea of loving one another. And the Bible tells us specifically that fear and love are opposite. And that when you are filled with fear, and we know this, you know, from our own experience, that fear causes people to do things that they would not ordinarily do. Now that word torment there in the Greek, it means penal punishment. And so what we're finding here is that the absence of love that fills people with fear, this experience of fear leads people, I see people being led to support penal punishment. We see that taking place in our society today so much in the, I guess, the mandates, the coercion, people that are supporting this, supporting coercion. And this connects with another Bible verse, and that is 1 Corinthians chapter 3, verse 17, where it says, where the Spirit of the Lord is, there is liberty. God is love and God is liberty. And we're seeing an absence of love. We're seeing coercion come in. We're seeing penal punishment come in the place of love, which is being motivated by fear. This absence of love is also leading people to lose their liberty. So the Spirit of God is being removed. Love is being replaced with fear, and that's leading to these penal punishments in these different forms we see developing in our world today, and especially in this country.
Wow. Thank you, Pastor Rafferty. Again, coming back to this beautiful triad, understanding that the physical, the mental, emotional, and the spiritual all play a perfect role in this holistic health that God gave us in the Garden of Eden. And I dare say he wants to restore the image of him in man. And I think it's holistic health he wants to restore. So thank you, Pastor Rafferty, for being able to bring that out to us so clearly. Now, I want to come back to pivot a little bit. The other part of today's talk was a discussion that actually, again, pertains to all of us. It doesn't matter if we're unvaxxed or we're vaxxed. All of us are at risk right now for COVID. The variants are rising. We've already talked about that. Dr. McCullough has mentioned to us that 90+% are the Delta variant. And again, it's affecting the vaxxed and the unvaxxed. And treatment, early treatment, thereby applies to everyone. Yet, for some reason, early treatment is being suppressed, or so it seems. What is early treatment and why is it being suppressed? Again, I want to invite my very amazing mentor, Dr. Peter McCullough, who literally wrote the book on early treatment. Dr. McCullough, we are so glad that you are here with us to describe for us more in detail your protocol that has literally saved thousands around the world. Can you tell us a little bit about that again, sir, please?
Yeah, just a brief comment. You mentioned that we're all at risk for COVID-19 infection. I wanted to clarify that those that are COVID recovered, like yourself and like me, we are not at risk for COVID-19 reinfection. Yeah, there has not been, you're not going to get it again. You made it through. You look a lot better than you did when I saw you at the main meeting. But you've rebounded. But the point is, those who are COVID recovered have robust, complete, and durable immunity without significant risk of reinfection. If we would have seen significant reinfection, it would have been apparent by this point in time. So I think that's the group of individuals. Whether somebody's gone on to take the vaccine or not, that's the group that really can be rest assured. But for those who have either taken the vaccine or haven't, it's possible that the Delta variant could come knocking at your door, and I want you to be prepared for it. So if we can bring up the slide, we have an updated treatment algorithm, and unless maybe I should share mine. I had submitted it ahead of time. Okay, here we go. Here's a treatment algorithm. So look at the very top here. If COVID-19 is diagnosed with either PCR or antigen testing, the white box, that's the time to actually get home, self-quarantine at home. If you're at work or school, do put on a mask and go ahead and get home. We ask that you go ahead and start now. This is new. Povidone iodine, that's betadine. That's the brown liquid that doctors use to sterilize wounds. Just put a few drops in a glass of water, small glass of water. I mean, very, very dilute, just to turn the water brown. And go ahead and swish and spit that out. Don't swallow it. And also, you can either use a nasal dropper or just use a Q-tip and also do the nose with that at least twice a day. And acutely sick, we can increase that to 4 times a day. But we're now recommending, like they do in Singapore and so many other places, povidone iodine as general nasal and oral hygiene for prevention, and then an active treatment to cut down the viral loads. With the Delta variant, we know that the Delta variant individuals are carrying about 250 to 1,000-fold viral load of the previous variants. This is one of the reasons why Delta is such a big issue for us, is people who have it carry so much of the virus. Do contact tracing, reduce your contagion. That is, have people sleep in separate bedrooms and open the windows and doors. It's fall time. It's starting to get cooler. Ventilate your house with fresh air. Do not try to stay in a room and keep breathing the air. If you can get outside, spend as much time outside as possible when you're sick with COVID-19. Now, age under 50, no other medical problems. We recommend a nutraceutical bundle, as you can see there, zinc, vitamin D3, vitamin C, and quercetin in the doses. You should have those on hand at home. Those are easy things to buy on Amazon, along with your betadine. And then watchful waiting, and you complete self-quarantine. Our CDC says now, if it's 10 days from the onset of your illness and you don't have any symptoms in the last 48 hours, you can go back to work. No test is needed. Now, if symptoms worsen, then we move into the treatment algorithm, and we do feature the Regeneron antibody, carasivimab, indimab infusion, and these are available in all major metro areas. Make sure you know what hospitals and urgent care centers carry the monoclonal antibodies, and try to use these on day 1, 2, and 3. I just had 2 of my patients yesterday get it on day 1, and I can tell you, if you can get it on day 1 or 2, they're going to do great. Clearly, those over 65 with medical problems are your highest priority patients, but younger individuals with severe symptoms or medical problems, also keep them in mind for an antibody infusion. After that, we can move into 2 anti-infective agents. If you've used an antibody infusion, it's not so mandatory that you use hydroxychloroquine or ivermectin. You can simply add the doxycycline and azithromycin and move on. But if you haven't gotten a monoclonal antibody infusion, you probably do need the 2 antivirals. It's either hydroxychloroquine, 200 milligrams twice a day, supported by over 250 studies, or ivermectin at doses that are typically now 18 to 36 milligrams in doses over the course of about 5 days or so, and that's supported by over 60 studies. Again, we add azithromycin or doxycycline for additional benefit. Inhaled budesonide should be ordered now in all of these patients over 50 with medical problems. 800 micrograms twice a day. It's a Pulmicort inhaler or nebulizer. And then steroids. The most common steroid use is prednisone. The most common dose now is 20 milligrams twice a day with a taper. And don't forget colchicine, 0.6 milligrams a day for 30 days. Patients with additional risks for blood clotting, and keep in mind when the oxygen saturation goes down, that's blood clotting. That's not the virus, that's blood clotting. We do recommend for all adults now aspirin 325 milligrams a day, starting at the beginning of illness out to 30 days. Patients with atherosclerosis out to 90 days. And then our high-risk seniors, go ahead and put them on Lovenox or low microwave heparin, 1 milligram per kilogram twice a day, or start oral Eliquis or Xarelto or Pradaxa, one of our standard oral anticoagulants. Keep in mind the shortest duration of treatment is about 5 days. Average person about my age, so let's say people in their 60s or 70s, would be 10 days. And then a high-risk senior citizen, someone in a senior home, people with elderly, multiple problems, figure on 30 days. It's a long illness. We have oxygen concentrators. You can make a phone call to a medical supply company, and with the current emergency orders, they will get the oxygen concentrator out to the house ASAP. That can help people and reduce some of the anxiety. This type of program, as described, seems complicated, but it's about 4 to 6 drugs in sequence combination. No single drug is essential. So right now in some of the countries, ivermectin is being curtailed or hydroxychloroquine is being curtailed. It's honestly not a big deal. We can operate this algorithm without ivermectin or hydroxychloroquine and still provide high quality care. It's been shown that this algorithm can reduce hospitalization and death by about 85%. But it does take dedicated doctors to do this. We need to have more doctors coming off the sidelines and doing this. One of the reasons why we're promoting the monoclonal antibodies so much, because they are FDA, EUA approved, and giving monoclonal antibodies should get some of our bigger health systems and clinics in the game of early ambulatory treatment. So I'll stop here and let you go ahead and take over.
Thank you so much, Dr. McCullough. We'll come back to you in just a minute. And following your protocol, we're excited to welcome Pastor Ric Swaningson. Pastor Swaningson is the president of Adventist World Aviation. And Pastor Swaningson, there you are. Wonderful. It's good to have you with us. There you are with your airplane. We're very happy to see you. You know, you and I kind of went through COVID together. You want to tell us a little bit about your story and what happened to you with early treatment? We'd love to hear that. And we have you muted, sir.
Can you hear me now?
Yes, we can hear you.
Okay, good. So I was listening with great interest, our physician and epidemiologist talk about not only the nutraceuticals, but the, I guess, the allopathic treatment as well. And you're right. I met you down at ASI, and I think we shared more in common than we probably wanted to. And but right away, you helped me. You turned me over to a program that was able to get me early treatment, with the recommendations that our good doctor was just explaining just a moment ago. Of course, I did the inhaler. I still got the box right here, and I'm going to let you pronounce that. That's the one. You said that just perfectly. I want to tell you, first off, I followed that with the directions with the nebulizer. My O2 sats, of course, being a pilot, we keep pulse oximeters with us handy in our flight bags, because should our oxygen levels drop, we have to do something about that right away. My oxygen saturation never dropped below 95, and that was moving. And I think that was a lot because we did the early treatment with the vitamin C, high dose vitamin C. I have the list here, but I was reading it on the previous list there, where you have the nutraceuticals up. Zinc 50 milligrams a day, magnesium 400 milligrams a day. That's what I was taking anyway. Vitamin D 5,000 international units a day. Quercetin 500 milligrams, and I was doing the 325 aspirin already. And a few other things I take just naturally. One thing I add to it is rose hips with the vitamin C. I believe that helps increase that. And then turmeric was another thing that I did. But by following, of course, then the ivermectin, went on that right away. I want to tell you, it was a living perdition for 3 days, but I could tell there was improvement right away. I forced myself to go outside with the hot and cold treatments. Inside was air conditioned. Outside was hot in North Carolina here. I got as much sunshine as I possibly could. I even forced myself to move around a little bit. Even tried mowing my lawn with a push mower a little bit, as much as I could. Getting as much sunshine, doing as much fresh air and activity as I could, while keeping an eye on my pulse ox and making sure that my saturation didn't drop too low, and kind of watching my pulse and, of course, my blood pressure and such. But it's survivable. I think you were going through some of the same things I was going through. But the hot and cold therapy, I want to tell you, that worked. I would get hot outside. I didn't quite do it in the showers. I just didn't feel like a hot shower because I was outside in the heat already. But I went in and did cold showers after that. And that made a tremendous difference. And I don't know, I suppose that increases the circulation in the system. But I want you to know that the system does work. It's survivable if you get into early treatment. And I was really interested in that right away. Of course, I had been taking echinacea, golden seal, zinc. I forget what the milligrams of zinc, but I was already taking zinc anyway. But I did up the dosage to the recommendation, and a few other of the nutraceuticals that were recommended. But it works. And it's survivable. And our CEO, or CFO rather, I'm the CEO, but our CFO also contracted it down there, Betty Haas, and her husband. They also followed the recommendation of that. And then we have another board member that contracted it. In fact, he's just getting over it right now, following the same treatment. And because we got him early, he was looking like he was going to have some serious problems. But once he started the medications and the prophylactic and all the different things that we just discussed here a second ago, he started showing immediate improvement within 24 to 48 hours. He started really turning the corner.
Well, thank you so much, Pastor Swaningson. And again, you're the president of Adventist World Aviation, and thank you again for joining us. We appreciate that very much.
My pleasure.
And we want to come back to Dr. McCullough. Dr. McCullough, we have so many, I'm sure you have hundreds and hundreds of testimonies of patients that have successfully made it through, praise the Lord. But it does seem to be getting harder. I mean, as a provider, as a physician, it seems to be getting harder to prescribe early treatment to patients. And you said something that I thought was very encouraging. Whether there's certain medications that may be more difficult based on different governing bodies, what can we do about that? What's happening, and how can we sort of navigate this process as physicians?
Sure, there is certainly an increasing set of barriers that we have to deliver high quality care to patients. I can share with you a recent anecdote. As I was called to see someone, and I'm to the point now where I make some house calls to check on people on the weekends. And it was a man in his 60s who was overweight. He had COVID-19. He had been fully vaccinated. And I went to see him in his room, and he was wearing an N95 mask. And you could see the sheer terror in his eyes. He was absolutely terrified. And I told him, I said, take off that mask. And I wasn't wearing a mask. I've already had COVID-19. I can't get it again. He goes, you're not wearing a mask. I said, it doesn't matter. I can't get it. And I can tell you, I saw him a week ago, and I don't have a COVID-19. Once you're recovered, you can't get it again. And to just get him to take off his mask, open the windows, and reduce the anxiety. In mild cases, honestly, I think some of the nutraceuticals and supplements and just compassionate care and reassurance took someone who was destined to be a hospitalization. Because there are data from the paramedics run sheets in Seattle and other counties in municipalities that a lot of patients go to the hospital. They're not in severe respiratory distress. They're just in sheer panic and fear. And just by compassionately taking care of patients, I think if we had a national phone call program and we just called our high-risk seniors and kind of walked them through this illness, we could drop hospitalizations dramatically. But as you alluded, the Delta variant does seem harder to treat. It seems to be a longer illness. And I think one of the reasons why is the viral loads are so high. And that's partly because the vaccines are only partially effective. And so the vaccinated state seems to be allowing very high carriage of the Delta variant. And our CDC director has come on TV and told us that. Papers by Fahrenholt and Venkata Krishnan and by Chow, you can find all those first authors are reporting, and Louis, actually from China now, has reported these very high viral loads. I personally underestimated how difficult the Delta peak was going to be for us, just because I didn't anticipate that the vaccinated could get Delta as readily as they are. And then also the viral loads being as hard. Now, the good news is that it looks like we've rounded the peak of the Delta outbreak and we're on the way down now. And as things come down, I think we'll see these anxiety levels come down. We'd like to see a kick in of the oral nasal hygiene program, and we're behind on that. They've been doing that in other cities. I mentioned povidone iodine, but if someone's iodine allergic, dilute hydrogen peroxide works. It turns out that even dilute sodium hypochlorite or a few drops of household bleach works in the nose and is very, very effective. And then least effective is Listerine, but you can still use it. The American Dental Association recommends oral nasal hygiene for cytomegalovirus and for Epstein-Barr virus. And because just like hand sanitizer, any form of hand sanitizer kills the virus easily, we want to see everybody get into oral nasal hygiene to cut down these high viral loads we're seeing with Delta. Twice a day helps prevent acquisition of COVID-19 in randomized and prospective studies. And then during the active phase, doing it 2 to 4 times a day cuts down the viral load. I learned this from anti-infective dentist Paul Gossett in Chicago. Paul recently told me he says that there hasn't been any dental outbreaks all year long, and I think he's right. And dentists have been in the mouths of people, he says, because the dentists and hygienists routinely do this. But he recently had a patient who came in and she was feeling a little sick. He worked on her mouth and he does his normal program, and she gave him a call back and said, you know what, I feel terrible. I have COVID-19. He put her on a 4 times a day dilute a povidone iodine and just the nutraceuticals. She was young. She rapidly cleared the virus. She never really got sick. He increased his prophylaxis. He didn't get sick either. So oral nasal hygiene, I think, is a big update. And then the medicinals. I'm not too worried about ivermectin or hydroxychloroquine. Honestly, if there's drug shortages or other restrictions, we can utilize the other medications.
Dr. McCullough, I cannot tell you how encouraging that is. That is so encouraging. And I hope our viewers are listening and understand how significant what Dr. McCullough just said. I think all of us can get access to iodine and some of these very other simple things that you talked about. In fact, I have to say, you advised me to use the Listerine, and I noticed a dramatic improvement myself. I had a sore throat. It wasn't, you remember we talked about that. It wasn't going away. I had been gargling with lemon juice and some other things, and it just wasn't working. And when I switched to Listerine, I switched it to 3 to 4 times a day. My sore throat went away. So I really do find it to be quite impressive.
Yeah, that's good to hear. Now, sometimes people say the povidone iodine, they don't like the brown solution. So I recently had a patient, he goes, Doc, I just can't bring myself to do it. I said, listen, just a few drops, very dilute, do it, spit it out, and then you can follow it up with Listerine to kind of freshen up your mouth after that. And he accepted that and it worked well. And you know what? He had a mild case. He's back at work. Thank goodness, nothing progressed. We're learning a lot about COVID-19. We have to be adaptable. I think the oral nasal hygiene is a big update, and the fact to be flexible with the drugs.
Absolutely. Thank you so much for that, Dr. McCullough. Well, with that, I'm really excited to bring another testimony. It's Miss Renee Dodson. Miss Dodson has a very special story to share with us, and it ended happily. Thank the Lord. It was regarding her mother. And Renee, you felt alone when you reached out, and just tell us a little bit about your story. We'd like to hear that now. Thank you.
Sure. So I returned from a trip that I was in California, and my mom had attended church that week. And about Monday, it was August 23 in the evening, she texted me and she said, my throat is scratchy. And I thought, uh-oh, because it's summer and my mom doesn't get sick in the summer or hardly ever. So we just started communicating with each other. By August 25, she had a fever. So 2 days later, So I said, we're going to the clinic and we need to get tested. I just need to know if that's what you have. So we went, and sure enough, it was positive. And so we started immediately everything that I knew, the ivermectin, different people were helping me, 2 tablets a day. So that would be 12 milligrams, vitamin C, D, zinc, quercetin, NAC. We started her on a Z-Pack. We started her on aspirin. Although when I was at the doctor's office that August 25, she's a very nice lady, but she just told me, I told her that I had ivermectin and that I had given mom some. I told her that I had hydroxychloroquine and that I could use that, but I was looking for guidance. And I also said I wanted to give her aspirin. And she said, absolutely no ivermectin, no hydroxychloroquine. They're dangerous. I do not recommend that. And I do not recommend any aspirin either. So we went home pretty discouraged. But I guess I'm pretty disobedient because I kept up everything, including the aspirin and the ivermectin. Her first week was very mild. It wasn't too bad. By the second week, she started to get worse, very achy, more of a cough. 13 days later, on September 3, we picked up some oxygen because her O2 sats were starting to go down. And I was concerned. You want to talk about anxiety? Just listening to Dr. Dana discuss the anxiety and fear. Even though I was reading my Bible, I still had so much anxiety and fear. It just didn't look good. 14 days later, it was Sabbath afternoon. Mom and I were sitting outside and we were talking with each other, and I was trying to encourage her, maybe we should take the hydroxychloroquine too, because I had had COVID in December. I knew that it had helped me, was one of the players in my story. So I reached out to Dr. Lewis, who was so kind to give me some of her time. And also she said she was going to try to reach out to Dr. McCullough, which I was ecstatic about because I knew he was a cardiologist and I had cardiology questions. Wanted to make sure I wasn't going to hurt my mom because I was getting no help from the medical community locally here. I can't tell you how alone I felt trying to just a common person trying to manage the healthcare of your 77, almost 78-year-old mother. It's a little overwhelming, and I wish that could change. So I said a prayer with my mom, and I said, I'm nobody. I'm not a doctor. I don't know, but I need wisdom. I need your help. I don't know what is right for mom. And just a few minutes later, Dr. McCullough actually called me. And he repeated to me everything about my mom, blood pressure and the bundle branch block. And so he knew right away who she was. He repeated it to me. I said, yes. And he said, it's okay. She can take it. So we hung up, and mom looked at me and she held the little pill in her hand and she said, well, here it goes. So she took her first one, and the next day it was her worst day. Her temperature had spiked to 102.3. She did not want to get out of bed. Her oxygen was going down. It was very stressful, but she continued taking the second hydroxy. Now she's willing for me to do the onion poultice. So I got as many onions as I could across her chest. We covered her up. We put the fomentations, the heat on her, and I very mildly took care of her. Then we removed it, and we would do just a rag. I didn't want to put ice on her, so we did it mildly, but she began to cough, and it was breaking up. There was, she was producing stuff. We used oregano oil with a humidifier. That gave her relief in coughing. And then that was Sunday. By Monday, she's beginning to take a turn for the better. And since this past Monday to today, Sunday, every day has gotten better, better, better. Today, she's using very little oxygen. Her numbers are back up. And I'm just so thankful I'm so thankful Dr. Lewis talked to me. I'm thankful that Dr. McCullough was willing to just give me a little encouragement that it would be safe. I'm thankful for the natural remedies. And I still have my mom with me, it's a miracle.
Praise the Lord. That's all I can say. Thank you, Renee. And you just brought tears to my eyes. And yes, thank you. And for the doctors, the nurses, the medical community, and the individual viewers out there, This is Dr. Lela pleading to you. Please. There are so many stories of other patients like Renee and her mom that need help. Let's stand up together and let's help these people. Let's do it. Let's do it despite fear. And with that, I want to bring Dr. Dana back. Dr. Dana, what is the mental effect of fear of being alone? Like Renee was just describing, the fear of being alone, caught in this situation. And what can we do about it? Let's focus on the positive. What can we do to overcome this fear?
Yes, if I can get the PowerPoint up, that would be great. There's a cycle for overcoming fear. And I'm so glad that testimony was right before this question that you just asked me. Powerful. And so we're going to go look through this really quickly, this cycle, for us to understand. This is how I love that visual aspect for people to really understand what are you talking about when you want me to be well mentally. So there's a cycle that I kind of work with people, and it seems to be very positive. And by the way, you cannot separate the mental with the physical and the spiritual. It's not possible. We try to do it. I know people who try to do it on the mental health, just deal with the mental, but you cannot do it. And so prayer is the number one aspect, and we'll talk about prayer. We'll talk about really quickly how to identify the root cause of the fear, how to study to overcome the fear, how to make the connection, which is another important concept, and then also how to claim the promise, how to look into promises to go forward and make decision. The hardest part about fear is that when you feel paralyzed and you cannot move and make a decision about anything, and so that's the problem. And when that happened, by the way, the impact increases a lot of all negative things. We're looking at pornography, people who are, there's an increase in that. There's an increase in domestic violence. There's an increase in substance abuse. The reason why people are fearful of dealing with the real situation, so they turn to something else, even gaming and all sorts of things. And so let's look at really quickly the cycle of overcoming fear. So the number one, as I mentioned, is prayer. If you look at a various study that's looking at prayer in the brain, it is absolutely fascinating. There's a doctor by the name of Dr. Newberg. He's a neuroscientist, and he has looked in the brain as individuals are praying, and he sees four things. That the frontal lobe increases, and the frontal lobe increases, which is a very good thing, that stimulates the ability for a person to make right decision, judgment, and so forth, and increase various aspects of their health as well. Their interior cingulate also increases. That is a very helpful in making connection and feeling compassionate towards others, and feeling compassionate, which is another very important part, because forgiveness is going to be a very important part, because there's a lot of people that did us wrong or probably are doing us wrong. And so we're going to need to know how to forgive. So that connection is also important. And then also he saw that the parental lobe decreased, which is another good aspect. Why? Because when that aspect decrease, you get a sense of unity. So you want to work with people more, in a more positive way. You feel love, you feel connected, and you feel closer to God as well. And so another aspect is the limbic system. Now, the limbic system has to do with a whole lot of emotions. And so that decreases, which is another good part, because of all the negative emotion that comes with fear. So those are the things that they're saying. That's number one. Number two is identify the root cause. Very important. First, I know it's important for us to understand what is fear. Fear is an unpleasant emotion that's caused by a belief system. See, this is why we cannot separate spirituality and mental health. So the belief system of someone, it seems to be, they see things very negative. They see things as people are very dangerous, and so they can't trust anybody, and they associate that with pain and threat. Ultimately, what we found, what I've seen even in my practice, is that the root cause of most fear is the fear of death itself. But the Bible tells us that God has overcome. He's overcome, and so forth. Therefore, we also will be overcome. And I love the fact that the pastor earlier mentioned that Bible text, 1 John 4, verse 18. There is no fear in love. Perfect love casts out all fear. And then part of that as well is to look at how to challenge the belief system that one has that causes the negative emotion of fear, and challenge them in a sense of looking at cognitive behavior therapy. So work with someone to go through those thoughts that are negative, of the belief system that are negative, so you can learn how to change that to a positive mindset. And by the way, if you have not read the book called Mind, Character, Personality, please do so. There's a chapter on fear. So I know I don't have a lot of time to discuss all the positive things that it says. But one important thing to remember, that God never forced the will or the conscience, but Satan himself, that's what he uses. He uses fear, he uses force to get us to be on his side. So remember that. So the fear itself is not coming from God. It's coming from the enemy to get us to be in line with whatever he wants us to do. So if we believe what God says, and he's not blinding us to tell us that evil is not going to happen in this world. We know that, but he's not telling us not to be afraid because danger is not there. We know that danger will be there, but we're told to be of good cheer because he's overcome. Therefore, we also will overcome. So third part is to study for yourself. Get away from social media. Social media is not science and it's not Bible either. Study for yourself. Look at the Bible. Look at spirit prophecy. Look at credible scientific research and pray for God's guidance for your life. And I think that's what the sister was talking about, how she was making that connection with God and so forth. Fourth thing is to make that connection. What is that connection? Connection for health. So connect to health. How do you do that? We look at the health laws, of course, deep breathing, eating right, exercise, the normal things that we know to do that we don't do sometimes. And sometimes we are tempted to do, avoid those negative alcohol and tobacco and substance uses. We know all of those things, but sometimes we have a hard time making that connection. And also connect with people. Get back to going back to church and making connection with the community. Very important. We're not made to be alone. And so, and by doing that, all the things that we learn, we can also help other people to get that connection that they need, a healthy connection that they need. Fifth thing is the promises. As you're studying, as you're reading, as you're hearing various science, put things together in line for yourself. Things that will improve your health, things that will give you peace, Bible promises. Claim those things, read them for yourself, and believe those. So that's changing that mindset from that negative mindset to a positive mindset as well. And sixth, and another very important concept is make a decision. Once you make that decision, if you're going to follow the regime that you have, follow it. The Bible tells us a double-minded man is unstable in all his ways. So make a decision and move forward because God is with you and he's going to give you that motivation, that encouragement to do that which he is challenging to do, wanting you to do as well.
Dr. Dana, I just cannot thank you enough. This is a time, yes, we have sad, discouraging things all around us, but this is the time we need to look to our Jesus, our God, and be encouraged. And hearing messages like yours, hearing messages like Dr. McCullough pointed out, it doesn't matter what Satan throws at us because God is more powerful and he will get us through, and he will get us through together. I think that's something that we really need to be encouraged about. Right. I want to come to Mr. Zirkle now. Mr. Zirkle, as we talk about coming together in a spirit of not fear, but love, as Pastor Rafferty talked about, a lot of people are wondering about what methods they may have of protection legally. Is there any legal protection for them to have access, if they so desire, to have certain early treatments, particularly those individuals who have family members that are already hospitalized with COVID? And another question is, other members of that have written in, other patients have written in and indicated that their physician has fired them because they decided that they did not want to be vaccinated. And so as a result, they don't have their family physician or the physician that's taking care of them previously. Can you tell us a little bit about how people should address these questions?
Yeah, so many states have a law called the right to try. So what's going on is your physician is probably telling you, there's a CDC protocol or something, and we just follow that here, and we won't give you these medications that you want, whether it be the ivermectin or something like that. There is statutes on many states, and you'll have to see if your state is one of them, called the right to try statute. And what that basically says is that a patient has a right to try medications that are not normally used for the disease. And so you can do that. So you got that issue. But the second issue that you raised is patients that get divorced from their doctors. Well, for both of these problems, the best thing you can do is go find another doctor. Now, if you're admitted to a hospital because you're sick with COVID, and you're probably if you're the one that's sick, you're not going to be fighting anyway. It's going to be your family members that are fighting for you. You're going to have to be able to find an attorney or someone to help you. And I know that that's going to be tough, but there are possibilities where you can do that. And there are a lot of rights that go with patient divorces. When they try to divorce you, you have a right to an appeal to all of that. So if at all possible, go to somebody different. If it's not possible, you do have legal rights. You've got to find an attorney.
Thank you, Mr. Zirkle, and it's a blessing to have you on our team and our Vice President of Legal Affairs. Again, thank you for your time. We really appreciate it. Well, with that, I have a follow-up question for Pastor. We are so excited that Pastor Miguel Crespo, who is the president of the New York Conference, has joined us tonight. Elder Crespo, yeah, thank you so much for joining us. You're there in New York. You've experienced, of course, the first wave where so many had passing there with COVID. And of course, you've experienced a lot of the mandates thereafter. Can you tell us a little bit about your perspective on liberty of choice or conscience and mandating certain treatments or no treatment for patients?
Well, thank you for having me on the program. First of all, we have in our conference folks who are on both sides of this when it comes to COVID and the vaccine, whether they're I'm going to say pro-vaccine or anti-vaccine, although I don't think those titles are necessarily descriptive enough, but you get what I'm saying. To be honest, I've taken a little bit of a different take in relating to our church members on this. Step back for a second and think about this, that for the good of the world, not just one country, but all the civilized nations of the world are saying, for the good of all, everybody has to do this. And they started out with enticements. They started out with lottery tickets, pizza, cash, giving some a certain amount of tuition for college to entice people to get the vaccine. And now it's turned to where now in New York City, for example, the mayor said the key to New York City is the vaccine. You can go to shows, you can go out to eat, you can go to the gym. If you don't have the vaccine, you can't do these things. And then it's been stepped up where many people now are facing the loss of their job if they don't get vaccinated. What I'm sharing with people, and I was preaching this in a church just a few weeks ago, that if for the good of all, the world is saying you have to do this. And if you don't do it, you're not going to be able to have a job. You're not going to be able to do business. In other words, you cannot buy or sell. Now, the vaccine is not the mark of the beast. But if you read Revelation 13, that there will be this push to force people to do something. If you took what we're seeing today and you removed the word vaccine out of it, and you put in worship, those who do not worship the way we, the majority, say, will not be able to buy or sell. We would be fulfilling Revelation 13 right now. I don't know what more can happen in our world for us to see this. And so what I've been trying to share with people, I think in a way, there's some real issues with COVID and some real discussions that need to be had with treatments. But I believe that we need to also keep an eye out to the bigger picture. That for people who used to believe that it's hard to believe how Bible prophecy could be fulfilled. How can the entire world come together? How are you going to get the Muslims, the Buddhists, the Christians, all these different religions to come together and push one thing? Well, if you scare people enough, they will do anything. And so what we're trying to do is help people, give them guidance. And I would say legal counsel is for those whose jobs are threatened. They need to seek legal counsel, because some folks are being told here that if you either resign or you get fired, and if you get fired, you are not even eligible for unemployment benefits because you got fired because you wouldn't get vaccinated. I don't believe that's legal, but I'm not a lawyer. So I'm just telling folks, get legal counsel. So for me, when it comes to this whole issue, I've been trying to focus the minds of people on something larger. And that is how our world is changing. How I believe that we're starting to see there's a precedent that is being set. This is how we deal with our problems. When the world is scared enough, this is what we'll do. And it's not, how do I put this? The mark of the beast is not the vaccine, but folks, if you took the word vaccine out and you put something else in, Revelation is about worship, who you're going to worship, we'd be right there. We would be right there. And so we're trying to focus people on the spiritual as well as the physical in terms of how are you going to deal with the potential loss of your freedoms, the potential loss of your ability to make a living, to something larger that I think is far more dangerous than COVID if you don't pay attention and get this right.
Pastor Crespo, thank you so much. That was very, very inspirational. And again, I hope our viewers are seeing this beautiful package that God has created, that his perfect plan is a physical, mental, emotional, and spiritual package. But I dare say the enemy, which we believe is Satan, has his plan too. It's a physical, it's a mental, fear, anxiety. We have physical death, we have fear, anxiety, and we have spiritual aspects as well that Pastor Crespo just talked about. So again, we want to look to our Jesus who has the perfect plan for us. And I thank you, Pastor Crespo, for bringing that out. Now, before we go on to our next segment, I know we're running just a little bit behind, but we hope that God is blessing your heart and giving you a spirit of love and not of fear tonight. With that, I want to bring us one point back that Mr. Zirkle had pointed out. If you find yourself in a situation where you're having trouble, whether you've been, fired from your physician or having access to early treatment, again, we have Liberty and Health Alliance has a telemedicine platform that we now have physicians in 15 different states, and we are available for your assistance if this is something that you're interested in, and physicians and medical professionals, if this is something that you would like to participate in, please indicate that at libertyandhealth.org. Send us an email and just let us know in the subject line, again, telemedicine, that you're interested. With that, I want to go to a very different topic, but it's along this same lines of God's perfect plan, this holistic, physical, mental, emotional, and spiritual healing, God's perfect, beautiful plan. And it actually was given to us in the Garden of Eden, but I do believe it's something that my particular church that I'm a member of, the Seventh-day Adventist Church, has been teaching for over 160 years. If you'd like to learn more of it, Dr. Dana mentioned it. It's in a book called Ministry of Healing. And again, Liberty and Health Alliance would be happy to provide that for you. Just indicate that in the subject line that you would like the Ministry of Healing information. Well, this wonderful, beautiful plan, if we can just show that on the screen, that God offers us wanting rest. I am tired of hearing about COVID. I am so tired of my patients being ill. I want rest from COVID. I really do. And it's an easy way of remembering God's 8 doctors. We can show that on the screen right now. Those 8 doctors were used. There it is right there. Matthew 11:28. Jesus says, "Come unto me, all you that labor and are heavy laden. I, Jesus Christ, will give us rest to body, mind, and soul, which we all so desperately seek." And this want rest acronym stands for water, the proper use of water, not just internally, but externally, which we're excited to talk about. Fresh air. Dr. McCullough talked about that over and over again, the importance of getting out in sunshine, in fresh air, eating a healthy, whole, plant-based diet, the best nutrition out there. Temperance, avoiding those things that are really bad for us. Alcohol, tobacco, drugs, and yes, even caffeine. And we can talk about that in a later time. Those things actually do affect our immune system. Getting proper rest, the benefits of melatonin, exercise, strenuous exercise, a minimum of 120 minutes is very predictive of an improved outcome with COVID. Again, Dr. McCullough talked about sunshine, ultraviolet radiation, and most importantly, trusting in God. Well, these principles were used during the 1918 pandemic with great success comparative to the local military hospitals. And we want to talk about those a little bit in more detail with Dr. Song. Dr. Margaret Song is a classmate of mine. We went to medical school together. She's an internal medicine and preventive medicine specialist. And we are excited to hear from Dr. Song, who has been treating on a regular basis many COVID patients. Dr. Song, can you tell us a little bit for the next few minutes about some of these things that you've been incorporating in your practice and how God has given you not a spirit of fear with COVID, but a spirit of love?
Thank you, Lela. Yes, I've been having the privilege of treating many COVID patients in the outpatient setting. Since mid-December of last year, I have been using medications such as ivermectin. It's been a key part of my outpatient arsenal. And I'm happy to say that I have not had anybody end up in the hospital, and I have not had anybody die with COVID if we were able to start early treatment within the first week or so of symptoms. However, I am seeing that pharmacists are beginning to block my prescriptions for ivermectin. Just yesterday, I was on call and trying to treat a scared mother who herself had COVID and her 15-year-old son. And the pharmacist refused to fill the prescription. Well, we found a way around that situation eventually, but I realized that I need to, perhaps going forward, rely more and more on other methods as well. I want to share some of the things that I've been doing with my patients that have been very successful in helping them to get well sooner. Even before I started using ivermectin last December, I was using most of these other, or many of these other modalities already, and having success in keeping people out of the hospital. So I tell them to be on a simple diet. Actually, diet is really key to helping to strengthen your immune system. So I tell them no sugar, no dairy, and no meat. We have data showing that a plant-based diet actually results in better outcomes with COVID. So I have them basically eating fruit, a very light diet, lots of water. I tell them to go outside. Don't wear a mask inside your home. I was surprised to find out how many people were actually doing this. And go outside, get sunshine, sit outside in your patio, even if it's in the shade, you have volumes of fresh air circulating. And then I do a couple of things that most people can do simply in their homes. One treatment that's actually an old remedy, old folk remedy, but there is some scientific basis for doing this, is using an onion poultice. I had a relative of mine and a couple of other people. I've been doing some house calls as well on weekends. I've been amazed at how quickly people's chest tightness and shortness of breath turns around with an onion poultice. So for a standard-sized man, I would probably use 2 large onions. For a small person like me, maybe 1 large onion would do. And I just chop it up and tell them to put it in a skillet, maybe with a tablespoon of water, and heat it up for a couple minutes just to soften it up a bit. And then let it sit and cool off for about 1 minute. And then either get a thin kitchen towel, or I like to use a pillowcase and just put the warm onions in there, and then put it on the bare chest of the patient while they're supine, lying down, and just kind of spread the onions around on the chest. And usually within 10 minutes or so, the patient does start to feel better. I've also been prescribing steam inhalation with essential oils like oregano essential oil. There's actually literature evidence for some of these oils as well as for the efficacy of steam. So I have people get a large pot and put about 3 inches of tap water in there, bring it to a boil, and then turn off the heat, remove the pot from the stove, set it on your table, and put about 2 drops of oregano oil in there. And then make a steam tent with a sheet covering your head and the pot, and inhale the steam with the essential oils in it for about 5 to 7 minutes. That could be very helpful, and you could do it two or 3 times a day as needed. I also, especially early on when people are having fever, body aches and chills, headache. The virus is in its rapidly multiplying stage in the illness. This is a wonderful time to hit with some heating treatments. It's very important that the patient not take any antipyretics if they're going to do a heating treatment. So try not to have Tylenol in your system or Advil within several hours before or after the treatment, because we don't actually want anything to block the fever generating ability of the heating treatment. We actually want the treatment to raise your temperature. And of course, that's not going to happen if you've taken Tylenol. So the easiest way that I found is to have people just sit in a very warm bath. Have the temperature, maybe started out about a jacuzzi temperature, but then increase the heat, take it up to 110, 111, 112, 113 degrees. The idea is to get you to sweat for about 20 minutes. So that would mean at least about a half-hour bath. I encourage them to have a basin of ice water next to them with a hand towel or washcloth in there that they could wring out and keep their face and head and neck cool. And you really need to heat up for about 20 minutes. Afterwards, rinse off with a cool shower. I would take the basin of ice water and just throw it all over yourself and finish off with that cold rinse. Dry off completely, go to bed, drink some more water, go to bed, and rest for at least 1 or 2 hours. I personally do something called general revulsive fomentations. If I'm able to do a house call, using bath towels and a microwave, and it's a bit too involved for me to describe how to do it here, but it involves hot fomentation to the back while the patient's lying on top of that. Contrast fomentations to the chest, so hot on for 5 minutes. They're sweating under a blanket, their feet are in hot water, they're laying on an ice pillow, and then I do a cold friction rub with a towel wrung out of ice water for about 30 seconds in between the hot. I've got a new fomentation cooking in the microwave while the present one is sitting, and then I unroll the wet and heated fomentation into a dry towel, and that becomes the next fomentation. And I do 3 changes of that, and we finish it off with a cold rub down of the whole body, limb by limb. We don't want to get the patient chilled. So that's been very effective. Usually they sleep very, very well after that treatment. I've also been using some therapies on my patients who are suffering after getting the COVID vaccine. I've been using some activated charcoal internally and a substance called black seed oil or black cumin seed oil that has some very powerful anti-inflammatory and antioxidant activity. And I just saw some studies done on black seed oil in the treatment of COVID. In fact, there was a randomized controlled trial from Pakistan using black seed oil. They used 80 milligrams per kilogram of weight 3 times a day, and that would be about 2 teaspoons of it. And they mixed it with honey and did that 3 times a day. And it was very interesting to see those results. And I think I'm going to start exploring that. I want to show a couple of slides here. I'm going to have to screen share because, oh, there we go. Thank you, Chris. All right. So this is just regarding the effects of steam inhalation in relieving symptoms of the common cold. Next slide. Just an article here about carvacrol, which is the active ingredient in oils of oregano and their antimicrobial properties. I'm going to move on here. This is a study from Finland showing that people who sat in a sauna for 15 minutes actually had higher white blood cell counts. So the immune stimulating effects of heat, very important. I'm going to move on to the next slide here. This is a study showing that sauna bathing reduces the risk of getting respiratory infections. This is preventive. People who sauna'd regularly, there was actually a dose response. So those that were doing this several times a week, it was more effective than those who were doing this just once or twice a week. And I want to move on to the next study here. This is hyperthermic treatment, and this is in vitro. So 20 minutes at 113 degrees Fahrenheit suppressed rhinovirus multiplication by about 90%. So there's some studies out there showing the effects of heat. I think I had one more slide. This is just regarding onions, Allium cepa. Actually, onions are a great source of naturally occurring quercetin. So I actually have my patients cooking a large onion with about 5 cloves of garlic and some salt, and simmering it for about 20 to 30 minutes, making an onion broth, and eating that. Onions have organosulfur compounds that can actually break up mucus and relieve the sensation of chest tightness. So with that, I'm going to thank you. So those are just some of the things I do personally early on in disease. And I've been very blessed to say that my patients have done very well with these treatments.
Thank you so much, Dr. Song. And I can personally attest, there's different ways of, just like all of medicine, it's an art. It's not necessarily just a textbook, it's an art. And there's lots of different ways of doing fomentations. We're going to have a whole show just on water treatment and some of the other things that Dr. Song has talked about. I do want to tell you all one thing. I practice in the hospital. That's my basis of medicine. And one of the aspects that the ICU patients, particularly in COVID, they will have them prone or laying on their abdomen. And I myself, having gone through COVID recently, found an opportunity where, in addition to the fomentations to my chest that Dr. Song was talking about, I actually laid prone or on my abdomen, put my humidifier down below my bed, and had my tent, if you will, over my head with I used eucalyptus oil. And I had that over, and I noticed a tremendous difference just laying prone. So there's a lot of simple things that we can do. And again, I believe these are words of encouragement and happiness as God continues to lead us forward. Well, with that, again, thank you, Dr. Song. I want to come to Pastor Benardo. Pastor Benardo, Dr. Robert Benardo, is the senior pastor of the Battle Creek Church. Now, something that many of you might not be aware of, but during I talked to you already about 160 years ago or thereabouts, when the Seventh-day Adventists were beginning to incorporate some of these health principles, these simple lifestyle principles. Again, this was before antibiotics and before many of the other medical treatments that we have available. We're utilizing a lot of the things that Dr. Song just talked about. Now, Pastor Benardo, Battle Creek is the location of Battle Creek Sanitarium. It was the flagship. It was the hospital of the day. John Harvey Kellogg had, I dare say, I think it was the Queen of England came and visited. Correct me if I'm wrong. Tell us a little bit about Battle Creek, if you will, as you are the senior pastor there in that town. Thank you, Pastor Benardo.
Oh, sure. Thank you, Dr. Lewis. Can you hear me okay?
Yes.
Great. Well, in 1863, a young girl with a third grade education got a vision. She had several visions throughout her life. Her name was Ellen G. White. And in 1866, the Western Health Institute started right here in Battle Creek. It was sort of floundering. About 10 years later, 1876, a young 23-year-old, John Harvey Kellogg, was called to be the medical director. And it sort of took off from there. It's interesting that about at that same time, you had John Hopkins was rising up. So you had sort of the allopathic and then the natural medicine kind of two streams coming up at the same time. And there were amazing results happen. I just read one story here from later. This is 1909. All these doctors were discussing treatments. And Dr. David Paulson said this. He said, "The way we regulate ourselves to drugs is what distinguishes us from other physicians." He related an experience in a hospital where half of the malarial fever cases were treated by himself and Dr. D.H. Kress with water treatments, and the other half with usual methods employing quinine. not only did their cases respond better than the others, but certain advanced cases were turned over to them by the other physicians as undesirable. They were treated also successfully by means of hydrotherapy. He also spoke of vaccination, of antitoxin treatments for diphtheria, and of other similar methods as being artificial means of supplying properties which the body provides for itself in a state of health. So a lot of this is lifestyle related, right? Most of the people dying have other comorbidities. For this reason, the use of such methods should not be classified as drug medication, he said. So there's a rich history to this, and these water treatments are so simple. Obviously, it takes someone to help the person do it. In some cases, of course, you can do a hot, cold shower yourself quite easily. But these are something that really God gave, I think, to this Seventh-day Adventist church, and we surely shouldn't keep it to ourselves. It's just another tool in the toolbox of a physician. So thanks so much.
Thank you, Pastor Bernardo. And I think, again, we're all working together wherever we're coming from, whatever experiences the Lord has given us. And our purpose is one goal. I think everyone viewing here is hopefully having the same belief that we want to help people get better holistically, the same way Jesus, when he came to earth, sought to treat people holistically in health. Well, with that, I want to come to Dr. McCullough. Dr. McCullough, we have so many doctors. Many may feel right now that they're not sure what to do. How can we inspire them? How can we inspire other concerned Americans that it's time, I dare say it's time to protect the dignity of life. It's time to protect the image that God has created in man. And let's work together. Yes, we're facing a pandemic. Yes, it is a terrible disease, but there seems to be ways that God has given us in our arsenal, as Pastor Bernardo just said. How can we inspire others to join, I dare say, a movement to human life? Thank you, Dr. McCullough.
We've heard some terrific testimonies tonight and wonderful presentations. I'm becoming increasingly convinced there are so many things we can do to reduce fear, suffering, anxiety, hospitalization, and death. So much of what we're talking about is compassion. And what we really need to do is we need to build circles of compassion and expand those circles. And the smallest things can really matter. A simple phone call, a follow-up, doing the types of things that provide symptomatic relief. We heard about poultices and steam and different types of scents. This is a respiratory illness. It's hard. Several of us on the video today have had it. We know what it's like. And it's not surprising to me that there is a multitude of things we can do to help people get through the illness, whether vaccinated or unvaccinated. The things that I would want to leave the listeners with is understanding that we're talking about three circles here. We have a circle of medical freedom. That's first and foremost, because that's our bodies. And to really fight hard for our medical freedom, our freedom of choice in terms of receiving the treatments that we want. And at this point in time, sometimes we need to demand them, and we need to work very hard to assure that ourselves and our relatives get the treatments that we want and deserve. And also our rights to accept or not accept forms of vaccines or other things that have come our way. The second circle is a circle of social freedoms. Social freedoms include our employment, include our schools and families. And now is a time to do everything we can to start to bring down these barriers of division. Today I traveled and I heard stories about families that won't attend weddings if people either are vaccinated or unvaccinated, or children can't see their grandparents. It's clear that no one is any more threat to another person without any symptoms. And I have to tell you, if people feel well, vaccinated or unvaccinated, they can interact with one another. They can enjoy their family relationships, their spiritual relationships, congregate settings. We just can go back to the 1950s or 60s. If we're sick, stay home. If we become sick in school or in the workplace, go home. It's that simple. It takes about 3 hours of face-to-face contact to transfer COVID-19. It's not a brief brush at church, or it's not a brief interaction at school. It's 3 hours of solid face-to-face contact. About 85% of all COVID-19 transmission occurs within the home, because that's where we have that 3 hours of face-to-face contact. So please, let's not ever have any discrimination with respect to who's taken or not taken a vaccine. And the third circle that this is influenced, so we have a medical circle, we have a social circle. The third circle is the economic circle. And so what we cannot do is we cannot let medical freedoms erode into social freedoms and have those social freedoms ultimately erode into economic freedoms. We talked about fear and anxiety. And what I know about this, when I ask my patients, what are you most fearful of? They're actually most fearful of depravity. They're most fearful of actually economic losses, because they know what that means. And if we preserve our medical freedoms, and that links to our social freedoms, the economics will take care of themselves. So those are my words. Thank you.
Oh, thank you. Thank you, Dr. McCullough. Sorry about that. That was very, very encouraging. And I want to come back to Mr. Zirkle. I want to have final closing thoughts from you, Mr. Zirkle, on legal hope. People need hope. We do not need fear at this time. We've seen again and again how fear directly affects us physically and spiritually. So can you leave us with a final thought on hope legally, Mr. Zirkle?
Well, the thing I just want to say is that the Constitution is still there. The courts are still there. There's still things that we can do. I want to make a warning, actually, though, to our society, and that is, people who would give up a little bit of safety or a little bit of freedom for a little bit of safety, they end up losing both. And I think that this is a time where and this will combat fear. This is a time where we need to be talking to each other. We need to find out who are other people. If you're at work and you don't want to take the vaccine, you need to find out other people that are in the same boat with you. In a lot of industries, especially in healthcare, there are so many people that don't want to take the vaccine that it doesn't even hardly matter if you have an exemption, as long as you all band together and do this. So I think we're living in a time where we really do need to band together, and we need to stand up, because if we'll stand up for whatever reason, if we'll stand up, I really think this is the time, and that we can do a lot. And there are a lot of people out there. As I've been doing this, I'm amazed at just how many people really, truly don't want the vaccine. And so now's the time to come together and just be proud of our country and the freedoms that we have, and demand them.
Thank you, Mr. Zirkle. And I want to come back to Dana again, because holistic health, Dr. Dana has done such a wonderful job presenting for us the importance of the mental and emotional health as we've gone through. I dare say this is the worst situation I've seen in my lifetime, and I'm sure it's been the case for many of you. Dr. Dana, one closing thought as we're running out of time. How can we choose love and not fear? How can we choose love, not fear?
Great. If you can, put the PowerPoint on for me really quickly. Just remember, as we talked about the cycle of overcoming fear, the cycle is just that. Remember, the enemy uses fear. So you got to make sure that you're always within that cycle. You're praying. You're identifying the root cause of the fear. Where is it coming from? Are you studying? You staying connected with God? You staying connected with others in church and so forth? You're claiming promises, and you're making decisions. Very important. Because remember, when you're making these decisions, after you make decisions, ask yourself the following questions, I would say. Ask yourself, is this something that you really believe in? That's number one, because fear, remember, it's about belief system. And then, is this something that's worth it? It's whatever it is it worth it to you? And then also, is this something that you're willing to stand on? And also, is God leading you there? If God is leading you to whatever decision that you've made, move forward in faith, definitely. Remember, there should never be a time that you make a decision because of fear. Never make a decision because you're going to lose your job. Never make a decision because of what other people are saying or whatever. Never make a decision because of fear. right? So you got to examine the fear, seek guidance from above first, and then seek guidance from others, and develop a plan and move forward in faith. Take action. Don't get frightened and stay there. Move forward in faith. That same text that we started off for in the very beginning is very clear. 1 John 4 verse 18. There is no fear in love, but perfect love, rather, which is Jesus Christ himself, cast out the fear, because fear has torment, and the one that does the tormenting is the enemy, and us human being, that fear is not made perfect in love. So we got to understand that is very true. The opposite of fear is love. So when we choose love, we're actually choosing health. We're choosing God. We're choosing eternal things. So we love by making decisions that take care of us, that take care of others, and that does what God is telling us to do. Those are the things that we need to remember. And also remember, John 17, God's prayer was that we may know him. As we're doing this process, we're getting to know who God is. And fear will be eliminated, because God is not fear. He is love.
Thank you so much, Dr. Dana. God is love. What a beautiful thing. And I just want to read what Pastor Ric Swaningson said. He said, I'm just going to read what he said here. He wants all of you to hear this. I don't want anyone to have the impression that I had a mild case of COVID after hearing his wonderful testimony, or that it was a walk in the park. I just followed what my practitioners advised. It was indeed a rough 2.5 weeks. However, because I followed the principles of holistic health, physical, mental, emotional, and spiritual healing, the things that the presenters presented tonight, I was, with much prayer, God healed. I was able to fight my way back to health. This is my personal testimony. So again, God be praised for the miracles that he has performed. And yes, viewers, he will perform for you as well. Well, with that, I'm excited to re-invite Pastor Rafferty. Pastor Rafferty, we've heard a lot about holistic health tonight. We've heard a lot about the relationship of spiritual and fear, spirituality and fear, and the mental aspect. We've also heard that this is not the mark of the beast. What's coming next, according to Revelation 14? And is that something we need to be fearful of?
Well, acting on fear, we're dividing, we're blaming, we're becoming more and more coercive. And only God's love and the Spirit's presence can really pull us out of this tailspin. Now, I've been a pastor who's been studying the Bible and specializing in the books of Daniel and Revelation for about 37 years. And I've been alive on planet Earth for about 59 years, but I've never seen anything like this. And I don't personally believe this issue is the fulfillment of Revelation 13 and the mark of the beast, because that prophecy actually revolves around, worship. But I do see a correlation in this present health crisis with the book of Daniel, chapter 1. And, what seems clear, at least to me, in conversations that I've had and I've heard on the mark of the beast issue, is that it's kind of being used as a straw man argument against people who are deeply concerned about the current issues. And they see these current issues setting up for a future fulfillment of the mark of the beast. We hear stuff out of Australia, no jab, no job. And there's vaccine mandates like we're seeing in New York City. They prohibit unvaccinated people from buying and selling and in many cases pursuing their educational dreams. This is not Afghanistan, and yet a certain group of people are not allowed to work. They're not allowed to get an education. They're not allowed to go to public places. Their very livelihoods are being threatened. I mean, where do you end up when you can't work, when you can't get educated, when you can't go to a public place? So no, this is not the mark of the beast issue, but in too many ways, it seems like a dress rehearsal to me.
Well, fascinating, and I'm grateful it's not the mark of the beast, but what is coming next, Pastor Rafferty? How can we end this on a spirit of hope and not fear for our viewers tonight?
Well, I think we need to recognize that the Bible can navigate us in all of this. The Bible tells us there's nothing new under the sun. And so if we go, for example, to Daniel chapter 1, we know that God's people were first tested in the area of their personal health choices. And they were forced in this test between being faithful to God in their personal health choices, and that later led to a test in the area of worship. So we have some parallels, to our present COVID issue right here, because in Daniel chapter 1, the Babylonian government basically insisted on taking care of Daniel's personal health choices. They thought they were doing what was best for Daniel. And so they gave him this diet and they said, this is what you need to eat. But in Daniel chapter 1, verse 8, Daniel purposes in his heart, and he says, I'm going to have to refuse Babylon's healthcare because Daniel believed that it was not best for him personally. So that was a personal choice that Daniel made. It was his heart experience. It was a conscientious conviction. Now, Melzar comes along. He's the local Babylonian government official in charge of Daniel's health, and they have a favorable, loving relationship. He has a regard for Daniel, and he cares about Daniel's health. And so we see some parallels here to what's going on in our world today. In other words, there's mutual concern, there's mutual convictions taking place. And in verse 10, Melzar tells Daniel, if you don't follow the Babylonian government's health plan that we've set up for you, you're going to get sick. And Melzar says, he says, and if you don't follow the Babylonian government health plan, you're going to put my life at risk. A lot of parallels here. And then there's these other Hebrew children in the same situation as Daniel, but they didn't take this stand that Daniel took in relation to Daniel's health, following God's principles like Daniel and his three friends did. The other Hebrews were pointed to as an example of why Daniel's friends should comply with the government health regulations. But here's what I love. Daniel asks for a time of comparison. He asks for a time of test. He asked to be tested on God's simple diet and in relationship to the government's requirements. And he and his three Hebrew friends were tested for a while, and it was found that their simple health regime was better than the government's recommendations. And that's what we've been talking about this evening. And that's the hope that I think that we have. A time of test. I am a COVID survivor also, and I got sick along with you and Rick around the same time, and it was intense for 2 weeks, but I followed all of the protocols that Dr. McCullough has laid out for us, and it made a huge difference, including, the recommendations Dr. Sang and Dr. Dana taking out the fear, the hot and cold treatments. So Daniel and his friends were given this time for a comparison study, and I think that's where we are right now. The verdict isn't in yet. We don't know what the future holds on this vaccine and these vaccines and what they're going to bring, and so people are nervous and they're hesitant, and we need to allow a little bit of freedom here. Daniel was allowed a little bit of freedom. There was relationship and love and respect, mutual respect that allowed for freedom of choice. So I think that the test on health, of course, and diet came before the test regarding worship. So I don't think we're at the mark of the beast, definitely not. But we need to recognize that this COVID issue, while it's not the mark of the beast, there's a lot of principles here that we're dealing with that are going to be resurrected when we come to the mark of the beast. Choices that the government is trying to make for people, individual choices that are being taken away, mandates, coercion. So just to summarize it, I believe in freedom of conscience. I believe in this present situation, that means that everyone should be free to choose whether they should be vaccinated or not vaccinated. And this is especially important since people sincerely believe that taking the vaccination would be a violation of the sanctity of their bodies, the temple of the Holy Spirit. So I believe, though, that vaccination is not really the issue here. I believe the real issue here is a crisis that revolves around coercion, and that's a principle we find in Revelation 13. I believe that the mandates to be vaccinated or lose your job or your educational, opportunities or your public access are a wake-up call in God's prophetic alarm clock. And I believe we now face an incredibly deceptive issue in America and in the world. I believe there are powers and principalities that are trying to pit vaccinated people against unvaccinated people. And I think that the issue here is really an issue of division, divide and conquer. And before we know it, all of us, whether we're vaccinated or unvaccinated, are going to be on the modern day plain dure, Daniel chapter 3, and being forced to worship, this image, so to speak, the image of the beast in Revelation chapter 13 and receive the mark, etc. We're not there yet, but we're moving in that direction. And we're going to find ourselves without liberty and without freedom and being coerced with economic pressure and mandated to receive the mark of the beast. Therefore, this time, I think whether we're vaccinated or unvaccinated, we need to stand together. We need to stand against mandating vaccinations. We need to stand for the principles of civil and religious liberty. Yes, this is a religious liberty and a civil liberty issue. It really is. It's an individual conscience issue, and we need to value that. It's blood-bought. It's prophetic. It's identified in the Bible, in history. And I don't think we can any longer stand on the sidelines. I think, like was said just now, we need to identify people who are standing with us. We need to not be afraid, lift up our voices. We can no longer afford to protect our personal jobs. We need to stand for principle individually in order to stand unitedly. We need to, as the words of that old Christian chorus goes, we need to dare to be a Daniel, dare to stand alone, dare to have a purpose firm, and we need to dare to make it known. Now is the time.
Pastor Rafferty, I am inspired. I am truly inspired, and I hope, viewers, you are inspired. As Pastor Rafferty said, as all of the speakers said, God has a perfect plan for us. He has a plan. We were created in His image in the Garden of Eden. In the image of God, He created man and woman to have freedom of choice, freedom to choose God's way or not God's way. Freedom to choose whether to accept something into one's body or not. But either way, we should be given the freedom of choice. And I, too, am inspired. It's time to stand. Brothers and sisters, we can no longer be afraid. Am I going to lose my job? Am I going to lose my house? What's most important? What is most important? My choice to follow the dictates of my conscience as I answer to God and God alone. And with that, I'm going to ask Pastor Rafferty to give us closing prayer. Pastor Rafferty, would you please have closing prayer for us?
Absolutely. Father in heaven, we just want to thank you for each one of the presenters this evening on this panel and the discussions that were generated about our health. I want to thank you for the doctors. I want to thank you for the pastors. I want to thank you for our lawyer friend and for the personal testimony of people, myself included, who have fought COVID, have overcome, have followed the protocols, have used the natural remedies and some of the lesser drugs and found recovery. And I just want to pray for this world and pray for this country and pray for individuals and you would heal the divide, that your love would come in and take out the fear, and that we would no longer be acting in fear, but we would be acting in love and respect to one another like Melzar and Daniel did, and that we would give people opportunities and freedoms to follow their conscientious convictions. Father, help us to stand for vaccinated people if we're not vaccinated, and help us to stand for non-vaccinated people if we are vaccinated, and help us to exude the spirit of service, as Dr. McCullough said, to visit people, to encourage people, to pray for people, to minister to people. Father, help us, we pray, and help this country, this world, for we ask it in Jesus' name. Amen.
Amen. Thank you. Thank you, Pastor Rafferty. Thank you to all of our wonderful guests. And with that, we have 10 minutes of question and answer. Before we go, again, if you have not gone to our website, libertyandhealth.org, please do so. Please subscribe to our channel, but also subscribe to get our newsletter. That's how we keep you abreast of what's coming next. With that, I'm going to ask my guests to rejoin me, and we're going to take 10 minutes of questions. I have questions in my comments section. We have Dr. Dana, Dr. McCullough, Dr. Margaret. Let's see if we can get Pastor Rafferty up here. See how many we can get up on the screen. There we go. We've got Mr. Zirkle. Okay, very wonderful. We have Pastor Ric there. Okay, very good. So I'm just going to take a couple questions, and we're going to go from there. Okay, this one is to Dr. McCullough. And we'll ask each of you to mute your mics, if you don't mind, until I call on you, and that way we won't get all the extra feedback in the background. Perfect. To my guests. Wonderful. Thank you so much. Okay, so next question coming up here. Oh, they're coming faster, and I need to slow down. Dr. McCullough, do you have any help for a young lady who has COVID and constant nausea? Do you have any recommendations for her?
Yeah, COVID-19 affects the GI tract. And I want everyone to understand that we can almost always find the virus in the GI tract. It does exit the body through the GI tract. I think when the nausea is there, it could be related to some of the medicines, but most of the time it's the illness itself. Just using Zofran or ondansetron is fine. 4 or 8 milligrams, basically 2 or 3 times a day should handle it.
Thank you so much for that, Dr. McCullough. Okay, we have another question. What are the historical precedents for vaccine mandates? Mr. Zirkle, I'm going to turn that one to you.
Yeah, so vaccine mandates go back a long, long time. There's actually a lot of talk about a case called Jacobson where they're saying, okay, this means that everybody has to get it. And I just want to say that case law is so old, and just about everything that case relied upon has changed. It would be kind of like saying slavery is okay because there's the Dred Scott case. No, not at all. Everything's changed. So there have been mandates for a long time, but we've never had a mandate for anything like this kind of a vaccine. I mean, this is so different. It's rushed through. It has lots of safety questions. So it'll be really interesting to see where this all finally ends up in the courts.
Thank you, Mr. Zirkle. This one comes to Dr. Song. Dr. Song, someone writes in, how about fasting in COVID? Have you noticed any benefit as far as fasting in COVID-19?
I have, both with family members and with people that I have recommended at least a partial fast. I haven't actually experimented with just a full fast, with nothing but water. I actually think that it's important for a healthy functioning immune system to get nutrients. So while I do recommend a very simple diet, oil-free, free of animal products and free of processed ingredients, I think that fasting from large meals, of course, most people don't really have an appetite when they're sick, so that takes care of that. But, at least a partial fast is helpful. I don't have experience with doing just a water fast with COVID or any other illness similar to that, so I'm going to refrain from recommending it.
Thank you so much.
I suppose it would be okay, but I don't have any specific experience for that.
Thank you, Dr. Song. And I'll tell you from personal experience, when you have COVID, you don't feel like eating. And that's what Dr. McCullough already talked about. You just have no appetite. Something that I did that was actually very beneficial. I know some of the doctors that I associate with have talked about other treatments. I actually used oral charcoal. Do not do it less than 3 hours between your medications. Wait at least 3 hours between your medications. The charcoal will absorb your medications. But the charcoal was very beneficial to me with that kind of nausea and helping my appetite to come back. Okay, I want to go to Dr. Dana. Dr. Dana, for someone who is suffering from anxiety and fear, can you just give us in one line sentence, what would be the best method of helping to overcome that?
Trust God. You wanted the best method. There is no other, but trust God. Examine the fear. The enemy, as we mentioned, throws fear. That is his method of attacking us. And that doesn't work. Of course, it gets stronger and stronger, ready to get you on his side. But he's going to use fear. That's one of his methods that he's used time and time again. We know that. And so because we know that, we got to prepare ourselves. So that's why we talk about the cycle of overcoming fear, because it's always going to be there. He's going to throw, family situation. If it's not you, it's somebody else. If you're talking about parents, and that's why, the stats are so real when you see that women, or parents themselves have the most fear. Why? Because they're just dealing with their children. So, the enemy uses the children just like he's using God's church because it hurts the most. So he uses fear to get us. So understand that. Go through the cycle. Prayer is important. Study for yourself, claim promises, and then make a decision. Keep going forward. All those things are very essential. And so you ask the simplest is trust God.
Thank you, Dr. Dana. I want to come back to actually Dr. McCullough. We have one here. As far as post-COVID, that brain fog that follows and that fatigue. What can we do to help with that?
Long COVID syndrome is now well recognized as a product of prolonged COVID-19 that goes untreated at home. It's another reason to seek early treatment, shorten the duration of viral replication from about 14 days to 4 days. But those, sadly, who get no treatment end up hospitalized. 50% of those in the ICU who come out have long COVID syndrome, brain fog, various other neurologic complaints, including headaches, sometimes focal neurologic abnormalities. There can be a cardiac injury, pleural pericardial pain. There is a protocol from the FLCC group, the Frontline Critical Care Consortium. It's called the iRecover protocol. iRecover. I will put the link in the chat box as soon as I finish the answer here. The iRecover protocol, take a look at it. It involves a lot of drugs. I personally have found for the neurologic syndrome a brief course of prednisone and then a drug called fluvoxamine that has been tested in randomized trials of COVID-19. Prednisone and fluvoxamine. If there's any chest or pericardial symptoms, I add colchicine. But go ahead and take a look at the iRecover protocol that I'll put in the chat box now.
Thank you so much, Dr. McCullough. That's very helpful. I want to come, Pastor Rick, in your own words, tell us how you feel after having recovered from COVID. Do our viewers here, they're asking, do our viewers have hope? And we can't hear you, Pastor Rick.
All right. Is that better? Yeah, absolutely. Put your life before God. There was a time during the whole thing where I thought, okay, well, maybe this is it. I had slept for about 2 days, and I was cognizant that I was sleeping. I woke up every now and again, and I thought, I am not getting better. I'm not waking up. My energy is sapping, and I was feeling EOL, and I thought, okay, well, this is end of life. I think, I'm nearing it. But the prayer, and again, the following the health principles laid out here tonight, there is absolute hope, without a doubt. And God will carry you through it. That's for sure. It does take time. You're going to fight. And Dr. Lela, I don't know what your experience was, but certainly mine was an interesting ride. It was a unique illness. It seemed like when it found one, when I'd go up and down. It was very manic. In one area, I'd get sick, and then I thought, okay, well, I'm okay. Then I'd get in intestinal distress, and then I dehydrated, and I was concerned about that. I was almost to the point where I thought, okay, I'm going to have to go get an IV stuck in with some saline solution or something, because my dehydration wasn't getting any better. But prayed and ate some good old-fashioned chicken broth and started recovering. But prayer is the key. The chicken broth too helped.
Thank you so much, Pastor Rick. I want to come to you. Final question, Pastor Rafferty. Before I do that, there's a little statement up here. Someone says, you've talked a lot about curatives, Dr. Lela. Well, what about prevention? Well, that's a very good question, and I'll just in a nutshell say the same things that we talked about for curatives as far as God's principles of health, those principles he gave in the Garden of Eden, go right back to him. They are your best prevention. I want to come to you, Pastor Rafferty. What do you do? And this is a question here in our box. What do you do if you find yourself in a differing of opinion with your church or your particular denomination, and you are ready to stand, but you're not sure how to stand? What would you recommend, Pastor Rafferty?
Well, each one of us in any crisis, especially, I'm going to just say, let's fast forward to the mark of the beast crisis. Each one of us is going to have to stand individually anyway. We see that in Christ's writings, in the gospel, in the Old Testament, Micah 7, but in the New Testament, Jesus says, we can't depend on our mother, we can't depend on our father, our children. Each one of us has to stand individually. And that's why we focused on Daniel chapter 1, because Daniel took an individual stand. He didn't even take a stand that was dependent on his friends. They all took the stand too, but he purposed in his heart, and he took the stand. And we're going to have to do that. no church is perfect. No church is 100%. You know, even Christ's little church had a Judas, had a Peter, you know, betrayal, denial, and we can't trust on other people, our pastors, our leaders in church capacity. And we've really got to focus on the Lord. You know, earlier you were talking about, you know, what can we do to get rid of the fear? And I love the answer that God is the answer to trusting God. As a pastor, I really believe that. And I feel like, you know, the social media. So when you look in Daniel chapter 1, another thing that I think is really encouraging there is Daniel said no to the Babylonian food and drink. And today we should say no to the spiritual food and drink. We are so soaked with the media, and it's so negative that is bringing fear. And maybe it's time to cut that off. Why not try it for 10 days? And look on the internet for stories that are positive, stories about animals and humans and all the different things that are happening in this world that are positive. And as Dr. McCullough said, visit somebody, reach out to somebody, help somebody who's in need. When we reach out to others, when we start focusing on the positive, when we shut off the negative, the fear is going to go away, because in those stories, in that communion that we have in our local areas, and in that individual resolution that we're going to have, no matter what our church is doing, we're going to find God's love. We're going to find God's Spirit, and that's going to cast out the fear, and that's going to keep us healthy, and it's going to heal us.
Thank you so much, Pastor Rafferty. Thank you to all of our guests, each and every one of you. It's been an absolute joy and pleasure to be with you here this evening. And I want to thank you to our viewing audience. I want to leave you with one final word of encouragement. Yes, as we mentioned, God's perfect method of prevention is his perfect method of treatment. Go to God. Ask him for the peace that passeth all understanding. Ask him what he wants you to do. And I promise you, I had to seek and beseech him for 3 straight days of fasting and prayer. But God is faithful. And just as he told me what he wanted me to do, he will tell you what he wants you to do. And that is the most important thing. And with that, again, I want to say God bless you and keep you until next time. Stay happy and healthy in him. God bless.